Nocturnal polyuria is the most common cause of nocturia. However, its pathogenesis is not well understood. Many factors are considered to be involved in the pathogenesis of nocturnal polyuria. Excessive water intake, excessive salt intake, and etc. have been reported to be associated with nocturnal polyuria. However, since these studies are cross-sectional, the exact causality has not been proven. In this study, we focused on the relationship between CKD and nocturnal polyuria. Since many CKD patients present with nocturnal polyuria, CKD is considered to be a risk factor for nocturnal polyuria. This report examined the relationship between CKD grade and daytime and nighttime urine volume, and showed that the higher the grade of CKD, the higher the nighttime urine volume. Many studies have suggested that CKD causes nocturnal polyuria, but its causality and its mechanism have not been proven. We conducted a prospective clinical study to elucidate the mechanism of nocturnal polyuria associated with renal dysfunction. Patients who underwent retroperitoneal laparoscopic nephrectomy were included. Patients with preoperative hydronephrosis, diabetes, or those on dialysis were excluded. Study design. Preoperative day 2 and postoperative day 7, we performed blood test and urine collection test. Urine collection test was performed every 12 hours, and urine from 10:00 to 22:00 was defined as daytime urine, and urine from 22:00 to 10:00 was defined as nighttime urine. eGFR, urine volume, urine osmolality, and urine osmolytes, sodium, potassium, and urea were measured. Here is the research flow. Patient characteristics. 49 patients were included. The median age was 64 years, and 24 patients were male. The most common reason for nephrectomy was kidney transplantation donor in 36 patients. The median operation time was 210 minutes. This graph shows the changes in eGFR for all patients. The eGFR was significantly decreased by 35% after nephrectomy. First, we examined the change in nighttime urine volume rate. The nighttime urine volume rate increased from 40.6% to 45.3%. This indicated that the nighttime urine volume rate increased as the renal function decreased. Next, we examined the factors associated with increased nighttime urine volume rate. First, we examined the changes in urine osmolality. Both daytime and nighttime urine osmolality decreased with nephrectomy, suggesting that a decrease in renal function resulted in decrease in urine concentration. Next, we examined the changes in nighttime urine osmolyte excretion rate. These graphs show the changes in nighttime excretion rates of urine osmolytes, such as sodium, potassium, and urea. All of them increased after nephrectomy. This indicated that a decrease in renal function resulted in a decrease in a nighttime urine osmolyte excretion rate. We conducted a multiple regression analysis to identify the most important factor that increases nighttime urine volume rate. The results showed that age, change in nighttime urine osmolality, and change in nighttime sodium excretion rate was significantly associated with the increase in nighttime urine volume rate, with the change in nighttime sodium excretion rate having the highest standardized regression coefficient. These results indicated that the factor most strongly associated with the increase in nighttime urine volume rate was the increase in nighttime sodium excretion rate. Finally, to clarify the mechanism of the increase in the nighttime sodium excretion rate, we compared the change in fractional excretion of sodium, FENA, and the change in renal function. After nephrectomy, daytime FENA increased by only 16.7%, although eGFR decreased by 35.9%. This imbalance between the increase in FENA and the decrease in GFR was suggested to be the cause of the decrease in daytime sodium excretion after nephrectomy. Traditionally, it has been thought that decreased renal function leads to nocturnal polyuria due to impaired urine concentration. However, the findings of this study indicated that increased nighttime excretion of sodium was most strongly associated with the nocturnal polyuria caused by renal dysfunction. The mechanism of the nocturnal polyuria caused by renal dysfunction is increased nighttime sodium excretion associated with decreased daytime sodium excretion. Thank you for your attention.